Today we're talking about eyes. Because if I had £1 for every time somebody said, oh, it's probably just a bit of sleep, I would not be working today. From a nurse's point of view, eyes are small, dramatic and very unforgiving. Ignore them and they ruin your week. But today I'll show you what's normal, what's not, what you can safely do at home and what makes us as nurses go, yeah, you need to come straight down. Here's the thing. As nurses, we are usually the first people to look at your pet. And the eyes are one of those things where they can look fine at breakfast and then be a full emergency by dinner time. We see dogs squinting, cats hiding under beds, owners saying they were fine yesterday. And yeah, sometimes they really were. Eyes don't mess around. Let's start with the good stuff. A healthy eye should be very comfortable for the pet. Bright, clear, and have no redness. No discharge, a tiny bit of morning crust is fine, we all have that. Not squint, not rub their face on the carpet, and not hide in a dark corner. Okay, small amount of clear, slightly cloudy gunk, especially after being asleep, that wipes away easily, is fine. Not okay is thick yellow or green discharge. Discharge that's coming back 5 to 10 minutes after you've wiped it away. Discharge plus squinting, discharge plus redness, or discharge plus sad, quiet pet. That's when we stop calling it sleep and we start calling it an issue that you need to see the vet about. Red eyes, the angry eye problem. Red eyes are like your pet's way of saying, excuse me, something's wrong. Redness can mean infection, allergy, foreign body, for example grass seed, ulcers or trauma. From a nurse's perspective, if the white part of the eye looks pink or red, that's not a wait and see situation. That's a let's at least have a look at it situation. Let me say this very clearly. If your pet is squinting, there's a good chance that eyes might be hurting them. Animals don't squint for fun. They don't squint for attention. They squint because it hurts to open the eye. This is one of the big things we triage at reception. Pawing at the eye or rubbing the face. The dramatic face rub, the carpet drag, the sofa corner attack. Here's the problem. Rubbing makes everything worse. Ulcers get deeper, eyes get scratched, and infection spreads. If your pet is pawing at the eye, use a cone, if you have one, to stop the rubbing, and then give us a call. Yes, they'll look miserable, but it's better than having to have eye surgery. Some breeds, we love them, but their eyes keep us employed. In dogs, we see pugs, French bulldogs, Shih Tzus, Cavaliers, and bulldogs. Big eyes, shallow sockets, lots of exposure. Cats, Persians, flat-faced breeds, or older cats with chronic eye changes. If you have one of these, eye checks should be routine, not occasional. Good news, there are things you can do at home and products you can use. Cleaning eyes safely. Use sterile saline or vet-recommended eye wash. See the comments below for a recommended product. Cotton pads, not cotton wool, as it sheds fibres. Wipe from the inside corner outwards and use a new pad for each eye. Keeping hair trimmed, especially around the eyes. Long hair poking into the eyes causes constant irritation. Daily checks. Quick look, both eyes, compare one to the other. If one looks different, trust your instincts. Please don't use human eye drops. Use old drops that you got last year. Use drops prescribed for your other pet. Use a home remedy recommended by your neighbour. Wait a week because it might settle. Eyes don't like guesswork. From a nurse's triage point of view, these go straight to the top of the list. Sudden squinting. One eye looks bigger or bulging. Eyes look smaller or shrunken. Blood in or around the eye. Sudden vision loss. Cats hiding and won't open their eyes. If you're thinking, is this an emergency? That usually means it might be. Get in touch with your vet. Pets are liars. Lovely liars, but liars. They eat, they wag their tails, they purr, but still have ulcers, glaucoma, infection, and sometimes even foreign bodies, especially cats. If their eye looks wrong, don't wait for them to act sick. What happens at the vet? Just so you're not scared. An eye exam usually means gentle examination. We pop some dye into the eye. It looks dramatic, like a zombie dog or cat, but it doesn't hurt. eye pressure checks sometimes, drops or ointments, and cleaning. Most eye problems caught early, we can treat, they heal quickly, and we can avoid surgery. Delay is what causes the horror stories. You want to be our favourite client? Come early. Bring the meds you've tried if you've tried something already. Tell us when it started and tell us if it's got worse or better. Don't apologise, you've done the right thing by bringing your pet in. We would always rather see a healthy eye than a damaged one too late. Eyes are small, sensitive, but serious. If something feels off, trust that feeling. From a vet nurse's point of view, early eyes equal easy fix. Late eyes equal big problems. And remember, if your pet's eye looks sore, red, squinty, or weird, your pet's not being dramatic. It's time to ask for help. If this helped you, share it with another pet owner. Check your pet's eyes tonight and check the links below for our other pet videos and our recommended eye products. I'm Jenny, and I promise you, veterinary nurses genuinely want to help you.